Be honest. Have you ever felt a strange pain in your shoulder during your workout at the gym and thought it was just a passing discomfort? What if I told you that this could be the first sign that something is wrong, and you didn't even notice? Many people think this way, until they realize that they were destroying the joint without even realizing it. You might think you're making gains, but the truth is, each rep could be pushing you closer to chronic pain, injuries, or even surgery. And the worst part? By the time you feel the damage, it might be too late. The shoulder is the most unstable joint in the body, and in this video, I'm going to reveal the 3 common exercises that are silently destroying your shoulders and show you exactly what to do instead to protect your joints and keep making progress. If you want to avoid months of recovery time and keep lifting pain-free, stick around because this information could save your gains. If you've ever felt shoulder pain after a workout, even a little discomfort, don't ignore it. That could be a red flag warning you that something's wrong. And trust me, shoulder injuries don't happen overnight. They build up slowly, rep after rep, workout after workout, until one day, boom, you're sidelined for months, maybe even needing surgery. The problem? The shoulder is the most unstable joint in the body, making it super vulnerable to bad mechanics and poor exercise selection. If you're doing the wrong movements, you could be setting yourself up for tendinitis, bursitis, impingement syndrome, or even a torn rotator cuff, injuries that can end your training for good. That's why today, I'm revealing 3 dangerous exercises that are secretly wrecking your shoulders. I'll break down why they're so risky and give you safer alternatives to keep you strong, healthy, and making gains for years to come. So stick around, because this is one video you can't afford to skip. But before we dive in, hit that like button, subscribe, and turn on notifications so you never miss content that helps you train smarter and stay injury-free. Let's go! The behind-the-neck barbell press is a very popular exercise in gyms, often used to work the anterior and lateral part of the shoulders, in addition to involving the trapezius and triceps. However, despite being a common practice, it is extremely harmful to the health of the shoulders in the long term. Let's better understand the reasons why this movement can be risky. The shoulder is one of the most mobile joints in the human body, with an exceptional range of motion. However, this great mobility also makes it vulnerable to injury, especially when required to move in extreme positions. The glenohumeral joint, the shoulder, is a ball and socket, composed of the head of the humerus and the glenoid cavity of the scapula. This joint is surrounded by muscles and tendons that provide stability and allow for complex movements. However, when these movements are forced or performed improperly, the joint can be overstressed, leading to injuries to the rotator cuff and other joint structures. The problem with behind-the-neck presses. When you perform a behind-the-neck press, the position of the movement places the head of the humerus in extreme external rotation, which means you force the shoulder joint to move into a very unusual position. This increases stress on the tendons, ligaments, and muscles that stabilize the joint. Here are some potential consequences of this position. Stress on the rotator. The rotator cuff is a group of muscles and tendons responsible for stabilizing the shoulder joint. When the arm is brought behind the head, the rotator cuff tendons are forced to work in a very vulnerable position, which can result in microtears and inflammation over time. These microtears can progress to tendinitis, or even partial or complete tears. Extreme external rotation can also lead to compression of the glenohumeral joint. This excessive compression can cause wear and tear on the joint surfaces, resulting in chronic pain, arthritis, or problems with the articular cartilage. Because the movement forces the joint beyond its natural position, there is a significant increase in the risk of dislocation. Risk of ligament injuries. The ligaments of the shoulder can also be compromised by constant overload. Ligaments provide stability to the joint and, when overstretched or damaged, can result in shoulder instability, increasing the likelihood of further injury. Alternatives. Given the risk of injury associated with the behind-the-neck press, it is highly recommended to avoid this exercise in favor of safer alternatives. Upright row, the dangers of shoulder internal rotation. The upright row is a popular exercise in gyms, especially among those looking to develop the upper trapezius and lateral deltoids. This movement is often used to widen the back and shape the upper back and shoulders. However, as effective as it is for working these muscles, it also poses significant risks to shoulder health, especially when it comes to excessive internal rotation of the joint. Let's take a look at why this exercise can be harmful and what you can do to prevent injury. The shoulder is one of the most mobile joints in the human body, allowing for a wide range of motion. However, this mobility also makes the shoulder vulnerable to injury, especially when repetitive or forceful movements are performed at awkward angles. The internal rotation movement, in which the arm is rotated inward from the body, can put strain on the tendons and muscles that stabilize the shoulder joint. The upright row is typically performed with a barbell or cables, and the movement requires the elbows to be raised above shoulder level with the arms in an internally rotated position. The main concern here is that this internal rotation puts the rotator cuff, a group of muscles and tendons that stabilize the shoulder joint, in a highly vulnerable position. Extreme internal rotation can put pressure on the tendons against the top of the humerus and shoulder joint, which increases the risk of impingement syndrome and other joint injuries. The main reason the upright row can be harmful to the shoulder joint is the excessive internal rotation that the movement requires. Let's examine the consequences of this internal rotation and the associated risks. The rotator cuff tendons are responsible for keeping the shoulder stable during movements. When the arm is raised in an upright row, the forced internal rotation can cause compression of the rotator cuff tendons, pressing them against the top of the humerus and the glenoid cavity. This repetitive compression can lead to tendinitis, inflammation of the tendons, and chronic pain. Impinge syndrome. Impingement syndrome occurs when the rotator cuff tendons are pressed against the shoulder bone, resulting in inflammation, pain, and decreased range of motion. Physical therapists often use the upright row as a test to check for impingement syndrome because the movement mimics the compression of the rotator cuff tendons, causing pain or discomfort. If you experience pain while performing the upright row, this is a strong indication that the exercise may be causing damage to the tendons. Risk of overuse injuries. Performing the upright row frequently or with excessive loads can lead to the development of overuse injuries in the shoulders. These injuries are particularly problematic because they occur gradually and may not be noticed immediately. Over time, the strain on the shoulder tendons can cause progressive wear and tear, resulting in serious injuries that require a long recovery period. Constant internal rotation can weaken the muscles that stabilize the shoulder, such as the rotator cuff muscles, making the shoulder joint less stable. This can increase the risk of dislocations or subluxations and make it more difficult to recover from other injuries. Dips on the bench. A dangerous exercise for the shoulders. Dip lines on the bench are a variation of traditional dips and are often used to target the triceps, pecs, and shoulders. While this exercise can be effective for strengthening the upper body, the way it is performed places considerable risk on the shoulder joint. When performing dips on the bench, the positioning of the body increases the pressure on the shoulders and can lead to injuries over time. Let's take a look at why this movement is harmful and what safer alternatives are available. The shoulder is one of the most mobile and flexible joints in the human body, which is excellent for many functional movements, but it also makes it susceptible to injury. When the shoulders are forced to move in extreme rotational positions, especially in directions that are unnatural for the joint, as happens during dips on the bench, it can result in overload and damage to the tendons, ligaments, and stabilizing muscles. In bench dips, the position of your body in front of your arms promotes internal rotation of the shoulder, which can put excessive stress on the joint. This internal rotation leads to increased stress on the rotator cuff tendons and can cause significant joint wear and tear, as well as increasing the likelihood of inflammation, overuse injuries, and even ruptures. The rotator cuff is made up of a group of muscles and tendons that help stabilize the shoulder joint. When these tendons are forced to bear loads while in a compromised position, such as doing dips on a bench, they can suffer micro-injuries. Over time, these micro-injuries can accumulate and result in tendinitis, bursitis, or even rupture. When you position yourself forward with your arms, you not only increase internal rotation, but you also place additional load on the shoulder joint. This excessive pressure can also lead to the development of chronic shoulder pain and difficulty performing other movements safely. Shoulder instability occurs when the muscles and ligaments that stabilize the shoulder are weakened or compromised. Frequently performing dips on a bench can weaken the stabilizing muscles of the shoulder, increasing the possibility of injuries. The exercises mentioned are very popular in gyms, but it is essential to understand that, despite their effectiveness, they carry substantial risks to the health of the joints, especially the shoulder. When performed improperly or with an excessive load, these movements can lead to serious injuries, such as damage to the rotator cuff, tendonitis, bursitis, and even tendon ruptures, which often develop silently, impairing functionality and mobility over time. Therefore, it is crucial that bodybuilding and functional training practitioners make conscious and intelligent choices regarding the exercises they perform. Form and technique should always be prioritized to reduce the risk of injuries. If the goal is to work the triceps, shoulders, or back efficiently, there are other safer and equally effective options, such as the barbell press at the front, dumbbell row, or barbell with the incline trunk, and cable triceps, which do not require extreme rotation movements, but are still powerful for developing strength and muscle hypertrophy. Prevention is key to ensuring that your workouts remain productive and hassle-free. Listen to your body, take a more careful approach, and, if necessary, seek professional guidance to optimize your workout and protect your joints. Remember, consistency and safety are much more important than achieving quick and risky results. By making informed decisions and adjusting your routine, you will ensure long-term progress, with less chance of injury and more health and quality of life for your body. If you liked this content and want to learn more about how to train safely and efficiently, don't forget to subscribe to the channel. Here, you will find valuable tips, smart training, and essential information to achieve your goals in a healthy and sustainable way. Click the subscribe button and activate the bell to stay up to date with all the news. Let's go together on a journey of safer workouts and longer-lasting results.